All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We are using our core CO2 for part 2 of our acne scar patient today. Now the reason I'm using this on her, this is the deep setting, is because she has that sort of irregular texture, that cobblestoning. And so by doing this deep setting, now if you look, there's a lot of spaces in between on the deep setting, because the reason is these are very deep, but they're not a high density. You don't want to do a high density on this because it'll make people red for too long. It may potentially cause hyperpigmentation. I don't think she would ever get hyperpigmentation given her skin tone, but we don't want to risk it. So this sort of very low density but very deep setting is really going to help remodel her scars on the long term. This is the end game. We're going to see the results of this in 6 to 12 weeks, up to even 6 months. But even by the time we hit the second treatment for her, if we're going to do another one in a couple months, she won't even see the results of this part yet, because this is the deep, deep, deep setting. So you see that very little deep. Now we're going to go onto the surface.
We're going to change. Doctor was changing his secret settings, guys. We're going to switch over. You can see right here, we're very deep.
So now we're going to go to a more superficial setting, but a higher density. So you guys can see much more coverage of the skin that's going to be ablated, but she's going to see more of a result this way.
Will there be pain and burning afterwards? What do we do immediately after, Dr. Emer?
We are going to put our botanical serum on. We are going to put our intense hydration mask for Emerage skin on, and then get her cool with the cold air. After that, she should be fine. Actually, most people very rarely feel pain.
So it's very interesting.
You guys could see.
Look at that.
This is the core from Cineron Candela.
We love it.
Almost done on this side. Great results when done right. And protecting yourself in the sun afterwards, really important. All done. Always check and make sure.
Is she feeling pain right now? Can you ask how she's feeling?
She's thumbs her up.
We have thumbs up right now.
So now we're going to turn. We're going to wipe off this side. Go ahead.
I'm from Indonesia, and I wish I could meet you in Japan. We have many patients that fly internationally to come see us for very unique treatments like this.
Side, okay. So we're going to wipe off. We're going to get the left side real dry. Use the alcohol too. Perfect. And you guys see I have specific markings here because I'm going to do 3 different settings. So settings are very important.
Can these be applied to the arm and hands?
Typically we don't like to do those in those areas. It doesn't do as well. Alright, so now we're going to start again with that deep setting. Less density, but deeper pulses.
Someone said you paint like an artist. Is this for anti-aging?
Well,
guys, this can be used.
It can be used for anti-aging, but
we're doing it for textural.
We're doing it for texture issues right now, for scars.
What
and you're right, I do like this. This laser is more of a painting laser than it is a stamping. What were you saying?
They're saying that what did the doctor do before this? We did a hybrid fractional laser to the whole face.
Exactly.
It's part of everything we do here is a combination.
Now we're going to switch the setting.
You guys can see all the little dots right here. We're going to change settings, and here's the other side. Right there.
Again, she's doing really great, which makes me super happy.
Someone said, love your work, Dr. Emer.
Thank you guys so much.
What is the price range for something like this?
Jordan, tell.
Guys, it really depends on the areas and the combinations we're doing and the skincare you're going to need for this. So send us a DM, full name, email, phone number. Our team would be happy to let you look at your skin and give you a consult, get you some pricing.
And this is a really unique laser because if you guys take a look, it's delivering the energy in rings. And these rings were designed to deliver the energy at very high quick pulse with not a lot of collateral damage. It's a special type of electrical current, different than every other CO2, but also with those little spaces in between. And so if you take a look up close, look at these little, look at the spots. See, look in between the lasers, like right in here where the line is, where the line is, where the line is. There's a lot of little spaces. That's gonna help her heal more quickly. And so again, I said I was gonna be a little more aggressive on this little section here. So we're just gonna fine tune. We call this airbrushing or feathering. Perfect. And that's it. So if we take a look, we just wanna go, just balance it a little bit higher, just to give it a little more balance. Just so that it looks a little more even when it's healing.
Can this be done on pustules? I was
Yes.
given with plasma.
We'd have to see. I'm not sure.
So it said your technique and precision is everything.
Thank you. Now I also told her I would just do a little bit over her nose, just because I want to get rid of some of those pores and any textural issues on the nose. So we're gonna work on the nose. Why not? Nose actually heals the best of any laser.
So she is in the best hands, and thank you for answering the questions.
I'm always here for you guys. You guys know how much I love doing this. We are here on a Saturday. We're all here on a Saturday. We have the whole Fifth
Love
Day
our
Wellness
patients.
crew.
We have
our
Whole Fifth
patients.
Wellness. We have Jose.
We have everyone. We have our patients leaving, you guys, while she's getting it done. She was very scared, okay, I want to tell you. But she did great, which is honestly, we're working together as a team to get everyone through it. That's why we're doing it. So Boca is all about family here. And then I just blend.
Does it damage dark skin?
This can damage any skin if not done right.
Any laser can cause damage to any skin if used improperly.
Exactly. This is how complete I am, guys. Can't let it go.
Every detail.
Every area. Even the triangular fossa, which is right here in the nose. This area tends to be missed frequently with laser. Okay, everything is great. All right, well, we completed our core, our Syneron Candela core CO2 resurfacing. It's gonna show you really quickly again, all those little rings. We're gonna get our serums on. Let's get our serums and get her to heal. And take off, we're gonna give her some cold air. That's step one. Guys, close this up. Number two, step two. Take your hand.
There you
use
go.
that cold air on your face, okay? Step two, the Emer Phyto ACNE Botanical Serum for hydration with hyaluronic acid.
And we have Jack over here with our PRP.
PRP, go ahead and apply.
And guys, the healing starts immediately as soon as the laser gets turned off.
Then the hyaluronic, vitamin C, all the botanicals in here, the thyme extract, cucumber, aloe, etc. All will help calm the skin down. And it's just an amazing product. I use it twice a day because I like it for glowing. She has a little redness. This will decrease her redness. So keep putting that on.
With the Emer skin. Let's talk about
PRP is being applied right now. Thank you. So that she can heal. That's growth factors from her own blood. And then the Intense Emer Skin Intense Hydration Mask. This has peptides. It has a hyaluronic acid, tea tree extract to calm the skin down and also prevent any acne. Licorice root for calming of the skin and brightening of the skin. And there's a citrus botanical blend. I pour a lot of this on as the last part. This is the little rain shower. So just wipe for me. Yep, go ahead and wipe. We're gonna get it. I always get it all over people's eyes and mouth. It's everywhere. But this serum is really important because it helps you heal. It's not gonna hurt you if it goes anywhere else. We're gonna get her real moist, real cool, and then we're gonna use, again, the best biocellulose mask that you'll ever try. We tried them all, and we made the one that we feel is the best post-laser. We're gonna apply this to calm the skin down, okay? And then there's a little bit of serum, just a little bit, that I saved, that I made, and in the mask so that everyone could have, and put it on later tonight when they have their extra PRP. So she's gonna take that foil home with a little bit of that extra serum in there, put it in the fridge, and apply it later tonight. Okay, it's right inside there, inside that mask. Okay, so everything is perfect. She's looking great. We're gonna let her heal, and we'll follow her over the next couple weeks. Bye, guys. Okay.